As Kenya moves towards universal healthcare, a new health insurance scheme is set to replace the long-standing National Health Insurance Fund, or NHIF. On October 1, 2024, the Social Health Insurance Fund, or SHIF, will take its place, bringing major changes to how citizens access healthcare. But with the new system just days away from rolling out, many Kenyans are concerned. Why is the NHIF being replaced? How will the new system work? And what does this mean for ordinary Kenyans, especially those in the informal sector? One of the biggest worries is the increased cost. Under SHIF, all formally employed Kenyans will contribute 2.75% of their monthly salary, with deductions capped at 5,000 Kenya shillings. For example, someone earning 100,000 shillings per month will now pay 2,750, up from the 1,700 Kenyan shillings they paid under NHIF.
Contributions need to come from all people, unless you are poor or vulnerable.
Because of its scope is broader. It includes laboratory investigations which are not covered previously, diabetes, hypertension, sickle cell disease, and chronic obstructive pulmonary disease, including asthma.
This rise has left many wondering if the new benefits will justify these higher contributions.
No employee will be fired. No employee will lose a job. We have three options. SHA will take, after it finalizes on its human resources instruments, will recruit those that they would like to recruit. And the first option in this recruitment would be NHIF staff.
And for those in the informal sector, things aren't any easier. Contributions will be made annually in one lump sum, with informal workers expected to self-report their income. While there are discussions around offering loans to cover these premiums, many fear this could push low-income earners into debt. Beyond the financial concerns, Kenyans are also confused about what services SHIF will actually cover. While the government promises expanded benefits like coverage for cancer and chronic illness, early reports suggest the coverage limits may be lower than expected. For instance, basic services like dental and optical care will be capped at 2,000 shillings and 1,000 shillings per year, respectively. Despite these concerns, the government insists that SHIF will help achieve universal health coverage.
Rollout is about preparation. Launching is on the 1st of November. Now we are rolling out. We are ensuring that the devices are in place. We are ensuring that the health workers have been trained. We are ensuring that even the claims people, anyone who's going to be involved in matters of health is trained. and the devices are there. The systems have been incorporated in preparation. Again, the transitioning, we are transitioning the NHIF clients. So currently, we have more than 4 million households, and so we intend to transfer that. So that's around 10 million to 12 million. Again, we have the indigents or the poor and vulnerable as identified by the Labor and Social Protection Ministry. Again, those will incorporate, and equally with the children. So through the education, and those ones, we can link up and see what family, because part of it is you register as a parent, and then you will put your dependents thereafter. So again, we'll get a good number. So we believe that before the launching, this is the rollout where we are now taking the steps towards the launching. We believe that we'll have enough Kenyans enrolled or registered before now the actual launching.
Okay.
Health officials have reassured the public that all NHIF contributions will be transferred to SHIF, then no one will lose their savings. Yet, the rollout has been shaky, with a lack of clear communication from the Ministry of Health, leaving many questions unanswered. So why the sudden change? According to the government, NHIF's limitations could not meet the healthcare needs of the growing population. SHIF, they claim, will streamline services under the Social Health Authority, improving access to care. But critics argue that the system isn't ready, pointing to issues like poor public engagement and delays in finalizing essential details. As SHIF rolls out, Kenyans will need to quickly adapt, especially as many still haven't registered. For those in formal employment, it's mandatory. But what about the millions in informal jobs? Will they be able to afford it, or will the promise of universal health coverage remain out of reach for many?
The reason why we are shifting from NHIF to SHIF is because NHIF is limited. NHIF only captures a small section of our society. It is my intention, as I made a commitment to the public, that every Kenyan must have two things: must have access to healthcare and must have access to health insurance.